Well, I think it's that time of month again, the first Friday of the month, and we're ready to kick things off for the monthly October Health Innovation Community Partnership meeting. With that, I'll go ahead and welcome everyone to our meeting space. We're starting the month of October now. My goodness, we've been in this mode now since March. And, we've been excited to have such great participation and your encouraging efforts around this initiative despite the incredible challenges of our times. And we're excited to bring to you several very important meetings and presentations today. You'll be hearing a presentation from the LA County Registrar Recorder's Office. We'll be getting several campus updates about the many projects that are happening on our LAC USC Medical Center campus. And we'll also be given some information on how to bring visibility and awareness to LGBTQ Awareness Month, which is the month of October. With that, we have, as I mentioned, a very full agenda, so I'll go ahead and get us started right now. So first things, before we move any further into our meeting, we just want to remind everyone about the tech tips for Zoom meetings. Please do mute yourself unless you are speaking. We want these meetings to be interactive. We highly encourage you to ask questions at the appropriate time and to always use our chat feature as a way of raising questions, comments, and concerns that our moderators can read out at the right time. You will notice that there is a control panel at the bottom of your screen that allows you to mute yourself, that allows you to turn your video on and off. You can also see the participants in the meeting with us, and you can access the chat feature and the interpretation feature. The participants area, if you click on participants, that will give you the opportunity of raising a hand if you would like to be called upon to ask a question. And that's also where you can access the interpretation. There's English and Spanish simultaneous interpretation going on throughout our meeting. As always, we want as many questions and as much interactivity as possible. So please do use the features of raise a hand or put a comment into the chat room. We'll also pause for questions throughout the meeting. I'd like to also reiterate our guiding principles as we join in the work together. This is a space for sharing and collaboration where we all come together on equal footing to help improve the conditions and create and realize supervisor healthy village on the adjacent communities to the LAC USC Medical Center. Our guiding principles are: all participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent, show how we reach our conclusions so that others can understand divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information, and participants will always arrive prepared for the meeting. During our meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. So thank you for bearing with me through the HICP guiding principles. With that, we'll take a quick overview of our agenda for the day. We're here in our welcome section. We'll be doing our meeting overview, and we've already read through our guiding principles. We have a few quick announcements this morning. Then we're delighted to welcome a guest speaker from the Office of the Registrar Recorder to talk with us about voting in the time of a pandemic. We will have our update from CEO Jorge Orozco about the LAC USC Medical Center. And we have several campus project updates that will be provided, as well as an update from our local and targeted worker hire working group. Finally, we will conclude with a presentation on proudly making October LGBTQ Visibility Month. I do want to make one quick mention about the final segment in our agenda. We're delighted to have with us today 2 student filmmakers from USC who will be receiving a recording of today's presentation, particularly the final segment, for potential inclusion in a student documentary film. We'll be making this announcement again later at that time, but please be aware that we will be recommending, if you do not wish to be included in the production, to please put your cameras on off mode or mute mode for the final segment today, but we'll be making that announcement a little bit later as well. All right, with that, we'll move right ahead into our meeting. We have a couple partner announcements. Firstly, our colleague Tiffany Roma was unable to join us today, but she definitely wanted to make sure that I brought to everyone's attention that there are several new job openings with the Department of Public Health. They are being contract employees through Healthcare Staffing Associates. They have an immediate need for new hires to help address the disproportionate impact of COVID-19 on communities of color, low-income communities, and other highly impacted communities throughout LA County. They are looking for community health workers, supervisors, liaisons, administrative assistants, typists, data monitors, analysts. Many, many positions are available, and we encourage, if you are interested, to please let us know. We will be sending out the links via email to everyone after the meeting, but you can also click through on the links in the PowerPoint presentation you received before the meeting began, and please forward those to colleagues and others that might be interested in these positions. With that, I'd like to invite my colleague Cristina Cardenas to give us a quick update on the work of our cashier.
Good morning, everyone. My name is Cristina Cardenas. I'm a program manager for LAC-USC Medical Center Foundation, and I have the pleasure of providing some highlights and some updates on our newly formed CACHI work group, where our vision is that everyone participates in building a healthy village to improve the quality of life for all. Next slide. So I just wanted to share our work group has met, we've had 5 meetings to date, and our work group has focused on children 0 to 5. We formed in August, and we are meeting every Wednesday, and we currently have established, looked deeply at the root causes of trauma, resilience, and we've looked deeply at indicators and goals to support community interventions. So we have landed on 5 goals at this time. We're looking at screenings and assessments, access to care and support, trauma-informed trusted organizations, healthy family and parent bonds, and lastly, education and destigmatization. We'd like to thank our CACHI work group members to date. We just want to thank everyone here on this list. The group is lending its expertise, its passion for looking at helping families, especially in this time of COVID, looking at long-term solutions, short-term solutions at addressing intergenerational trauma. We want to thank in particular Teresa Nuno here today for your leadership and guidance in this work group, as well as Rosa Soto and Heather Hayes for all your guidance during this process. And next slide. One thing that did come out of this task force is the idea of also engaging the community in a series of community listening sessions. We've shared it with the partnership, and these sessions will be held monthly. We had our first session in September called Parenting in the Time of COVID. Our future topics will include co-parenting, intergenerational parenting, and technology in parenting, especially during this time of COVID with distance learning. Our next meeting for the community will be October 28th, and these meetings are held in the evening to allow for parents to attend. And we've had presenters such as Leticia Lara, LCSW, who's also a task force member, present, and we will be providing various speakers to the community and to ensure that we are addressing any sort of parenting issues at this time with COVID, also trying to capture parents' perspectives on trauma to support the work group during this process. So just want to thank everyone that's supported this effort, and thank everyone that's supported with outreach to parents on this in this process. And I just see a question, are these meetings being held virtually? Yes, all meetings for the task force are held through Zoom, as well as the community listening sessions, which is great because the the access for the community is available. So we will be sharing the reminders and flyers for these upcoming sessions with the partnership. So thank you so much.
Thank you so much, Christina. I was talking to myself there for a minute. Anyway, with that, we're really excited about the work of the CASHI work group. You guys stay tuned. You will hear more to come, and we'll be certain to get out the announcement about this month's listening session to everyone shortly so that you can share that out with your networks. With that, I'm really delighted to invite Jeff Klein, the Manager of Civic Engagement, Community Relations, and Legislation from the County of Los Angeles Office of Registrar Recorder, to share with us a presentation on voting in the time of a pandemic. So get your questions ready so we can pose them to Jeff at the end of his presentation. Jeff, welcome.
Oops, sorry. How's everyone doing?
Great.
Great. So yeah, I'm going to talk about the upcoming election. I am with the Registrar Recorder County Clerk's Office. And so let me just go ahead and for the PowerPoint, I did add a couple slides. Did you want me to share my presentation, or did you want to?
Sure, why don't you go ahead, Jed,
Okay.
and take it over, and you can run it. And then if you can email it to me afterwards so I can get it to everybody. Yeah, awesome.
Absolutely. Okay, let me just go ahead and bring that up. 1 second.
Jeff, you're muted.
Sorry, having a little technical difficulties this morning. Okay, so again, I'm Jeff Klein. I am the Manager of Civic Engagement, Community Relations, and Legislation here at the Registrar Recorder County Clerk's Office. And we are here to talk about the upcoming election. There's a lot of changes for this election. In the March primary, we rolled out our new voting system called the Vote Center model. And that was a change from the polling place-based model to the multi-day vote center model. Since the primary, which feels like ages ago, we've had some additional changes, a number of the changes due to the pandemic and the public health crisis, then also some administrative changes around vote by mail and so forth. So I'm going to go ahead and talk a little bit about just an overview of those changes. One thing I do want to kind of start out by talking about is voter registration. This is a paper voter registration form. You can use the online voter registration form, which can be found at levote.net, or you can send in a paper application. One thing I like to use this slide, one reason is because we could highlight pre-registration, and that is something that 16 and 17-year-olds can do. They can pre-register, so once they become 18, they automatically are moved into the eligible category, and they don't need to worry about re-registering again once they're 18. And it's a really great way to get someone who's younger, is in high school, who's a teenager, who invested in the elections process and interested. Of course, you have to be a U.S. citizen to be eligible to vote. And there's a few other categories around justice involved, individuals. The rule of thumb for individuals who are justice involved is if they're at the county level, they're generally eligible unless they are serving an overlapping sentence that would be normally served at the state or federal level. Anyone on probation is eligible to vote. If you're serving parole for a state or federal level offense, felony offense, you're not eligible until you are done with your parole, although there's some legislation in the works to go ahead and change that. So that's something that's a pretty evolving process. Just want to make sure people who are interested in that sort of keep that in mind and look out for those changes. If you are registered and you need to re-register, you want to do that by changing your address. or when you change your address, when you move. Many people think that once you move, the post office will update your voter registration address. That is not the case. You need to complete a voter registration form. If you change your name, change your political party affiliation, or if you want to update your signature or any other information, as we're moving to more vote by mail oriented process, some people may want to update their registration signature. So that is something that you can use a voter registration form to do. Also, you want to make sure you register by October 19th. Anyone registered by that date will get a vote by mail ballot. If you miss the deadline, you can use a conditional voter registration process. I'll talk about that a little bit later in the presentation. So assuming you're registered and you're able to vote in the election, just a little bit of an overview of your options. So number one thing to know is that you'll automatically get a vote by mail ballot. You do not have to request a vote by mail ballot. We have 5.5 million voters in LA County. Every single one of them will get a vote by mail ballot. Although if you prefer to vote in person, you can do that as well. We are promoting vote by mail as the safest option in terms of public health because essentially it is contactless and it does not require someone to necessarily go out into public, into a vote center. But we do want to have vote centers because there are people who need to have that service. And so we will have 800 vote centers throughout LA County. Oops, I have a little typo there. 800 vote centers around LA County. And they will be open for, some will be open for 11 days, most will be open for 5 days. So the voting period really starts on October 24th. That's 10 days before the election. And when you add in election day, that gives us an 11-day voting period. I'll talk a little more about that in a minute, just around our vote centers and what to expect when someone shows up. For vote by mail, we have expanded drop box options. We have about 400 drop boxes around LA County. You can use any drop box to drop off your ballot, and then you can also mail it back. It is postage paid. We aren't anticipating any issues with the mail, but it is, the legislature has changed the election law to allow sufficient time for ballots to be mailed back to our office. So as long as they're received within 17 days from election day, they will count for the election. So if you prefer to use a drop box, that's great. If you want to mail it in, that's wonderful as well. And then you can also walk it into a vote center. Okay, so for drop boxes, this is what they would look like. So you might start seeing some of these popping up around LA County. We've started installing them. They will all be ready to go by October 5th. You want to place your ballot inside. Make sure you sign the back of your return envelope. Without the signature, we cannot count your ballot. If you forget to sign it, we will send you a letter and give you a second chance to correct that error. Vote by mail ballots go out on October 5th. As mentioned, there will be the drop boxes. Those will all be up and running also on October 5th. You can return your ballot by mail, by drop box, then in person. Again, if you return it by mail, as you see there, we have 17 days after the election to be able to receive it. It has to be postmarked by election day, so you can't mail it after the election. It has to be postmarked by election day, but even if it's a little bit slow, we will receive it within 17 days. If you would like to track your ballot, you can sign up for the Where's My Ballot program. It's a state program. It lets you know it sends you real-time notifications as your ballot makes its way through the process. So once we receive it at our facility, we will go ahead and send you a notification, or the system will send you a notification. And at other points along the process, you will also be sent notifications. You could sign up for that at california.ballottracks.net. And then LA County actually has its own vote by mail tracking program, which if you go to lavote.net, you can sign up for that as well. So you have your choice on what type of tracking program you want to use. Okay, so a little more on vote centers that I had mentioned earlier. So we do have 11-day vote centers. There's about 75 of them that will open on October 24th. It'll actually be a little bit higher than 75, but that's an approximate number. Excuse me. We will have, the bulk of them will open for 5 days, so that's about 725 or so. That gives us our about 800 total vote centers. They are geographically distributed around LA County. You can use conditional voter registration. So I started off by talking about how you have to register to vote, and you need to be registered by October 19th. If you miss the registration deadline, you can still show up in person at a vote center and register using the conditional voter registration process. Some people know it as same-day registration. And this allows someone to vote even on election day. They show up and they weren't registered to vote. They can conditionally register, vote a ballot. We'll verify their registration before we count their ballot. Okay, we have some exciting high-profile locations offered this election. Because of the pandemic, a lot of places do not have customers or fans coming out. So a lot of these really notable community facilities that we are so familiar with, they've stepped up and offered their location as a vote center. So just some examples I decided to put up here to give sort of a mixture of the different types of facilities. The Barker Hangar out in Santa Monica, the Galen Center, Dodger Stadium, Staples Center, Hammer Museum, Pantages Theater, the Four Seasons Hotel. A lot of other ones that are pretty recognizable will be stepping up. You can vote at any vote center in LA County. You're not restricted to one specific location like the polling place model. Under the vote center model, you can go anywhere in LA County. So if you're a big Lakers fan and you want to go and vote at Staples Center, feel free to go down there and cast your ballot. Or you can also just drop your ballot off there as well if you don't want to vote in person. The hours for early voting will be 10 a.m. to 7 p.m. And that's for every day through November 2nd. On election day, we will still have the traditional 7 a.m. to 8 p.m. As long as you're in line at the closing time, you will be eligible to vote. So if you're in line by 8 p.m. on election day, for example, you will have the opportunity to vote. Okay, if you do vote in person, we have something called a ballot marking device. We rolled this out in the primary. So I don't know, maybe some people here used it. It's our new voting system. And just a few features about it I like to always emphasize. One, it is a paper ballot. It is not electronic voting. A lot of people see the touch screen and think, oh, it has to be electronic. That's not the case. When you check in, you're given a paper ballot. You put that in the voting device and you use the touch screen to make your selections, but it prints directly onto the paper. It is fully secure. There's no internet or network connection. And if you go in person to a vote center, you'll see that there's just a power cord that plugs into an outlet. It's independent and private voting experience. So this allows someone, for example, who might be blind, the opportunity to vote completely independently. They do not have to tell anyone their selections. They do not have to give anyone their ballot. They just cast it right on the same device that they used. And it's really the first voting system that offers that total private voting experience, regardless of your level of accessibility. The design thought process that went into this is if the person with the highest level of assistance, who requires the highest level of assistance, if they can use it independently, then all of us can use it independently. So it's a really great, innovative design. It's fully accessible. You can attach an accessibility device. If you use a sip and puff device, for example, you can plug that in and you can vote using your sip and puff device. There's an audio headset attached. All languages that we provide services in LA County will be offered through this ballot marking device. You can also listen to your ballot in your language of choice. So this is great if you would like to hear your ballot in Spanish, Chinese, Vietnamese, any of the other languages we offer, or you can read it on the screen as well. And then we can adjust the screen for text size and contrast. So if someone needs to enlarge the text, we can do that. One other item that we did roll out in March, and this was actually really popular, was the interactive sample ballot. Many voters didn't realize that this was available until they got to the vote center and people really enjoyed using it. This is basically an electronic version of your sample ballot booklet. You make all your selections on your mobile device or your home computer, and then when you show up, you get your paper ballot, you put that in the ballot marking device, and you scan your poll pass, and it instantly pre-populates your ballot. It's not your vote. You still have opportunity to change it. You still have to confirm. You still have to print and cast your ballot. But this is an expedited process. I actually used this in the March primary. I went into our vote center here at the registrar. I got checked in. I got my ballot. And then I was in and out and voting after I got my ballot in about 2 minutes. So it's a pretty quick process. Really speeds up the voting process for everyone. Okay, a couple more slides here and then happy to do any questions. If you do want to vote in person, we will have social distancing and public health guidelines in place. Before you enter, they will ensure that you're wearing a face covering or a mask. We will have masks available if you forget one. Say you get really excited and you're running out of your car to go to vote and you forget to bring your mask. We will have one to offer. Also, we will have gloves available if you would like to wear them, although gloves are not required. All of our workers, of course, will have masks and will be wearing gloves. Everything will be social distanced, so the check-in line, everyone will be spaced 6 feet apart, and the voting devices will be spaced 6 feet apart. We will be wiping the ballot marking device down after every use to ensure it's clean and sanitary and ready for the next voter. So let me just give an overview of the timeline here before we wrap up. On September 24th, we started mailing out sample ballot booklets. I don't know if some people already received their sample ballot booklet. Last presentation I did a couple nights ago, a few people had said they'd already received it. It does take a little time for all of our mail to get out. I don't know if you've ever mailed 5.5 million pieces of mail, but it actually takes a little time to get all of that into the mail. So if you haven't received it yet, give it a few more days. You can, of course, go online and look up your interactive sample ballot, and that'll be an electronic version of who you're eligible to vote for, so you could look at it right there at this time. On October 5th, we will be mailing out vote-by-mail ballots. Again, similar to the mailing of the sample ballot booklets. Don't panic if you don't get it by October 7th or October 8th. It does take a little time to get out into the mail. I would give it at least a week, if not 10 days, before you start calling us up and asking, you know, where is it? And we can always send out replacements if for some reason you don't see it. Some people who aren't used to vote by mail, they don't know what to look for, and sometimes they overlook it in the mail. So just keep an eye out for it and let people know to keep an eye out for their vote by mail ballot. I think I sort of mentioned it at the beginning, but I just thought maybe I should be a little more explicit. You don't have to use your vote by mail ballot, by the way. You could just discard it and show up in person. So I wanted to make sure I was pretty clear about that. On October 19th is the registration deadline. Again, as long as you're registered by October 19th, you will get a vote by mail ballot. If you miss the registration deadline, you can, of course, go and do conditional voter registration at any vote center, which they start opening up on October 24th. And then November 3rd is election day, and then we are done with the election. Please follow us on social media if you want more information. We post a lot of really good information on this day and age of misinformation and disinformation and fake news and all the other phrases that we hear. It's great to share our information because the best way to counter all of that is to share the accurate information. There's my email if anyone wants to reach out to me and has any questions about something I didn't cover here or you don't get a chance to ask today. But happy to do questions at this time. All right.
Thank you, Jeff. We have a few questions in the chat. The first one is, where can we find the list of voting centers or a map? Yeah,
so it'll be up shortly. We will have a link to both our vote by mail lookup, vote by mail Dropbox lookup, and for the vote center lookup. We're just in the process of finalizing all the vote centers. They just got finalized the other day. And so everything will be up. If not today, actually, it'll be up in the next day or so. I have to see if they have the link active this morning. But also I wanted to mention that everyone will also get information in the mail. So we will be sending a booklet of all 800 vote centers to every single postal patron in LA County. So that's every household in LA County will get this booklet. So you're not even registered voters, and it's a great way to also let people know who aren't registered yet that you have an opportunity to do that. If you are registered, you'll get a postcard with a few of the nearest vote centers to your registered address, and on your vote by mail packet, you'll have a number of nearest vote by mail Dropbox locations on your vote by mail packet. So a lot of opportunities to get that information out there.
Great. Our next question is, has there been a consideration of having voting centers or stations at local hospitals, and most especially, of course, our dear hospital, LA Medical Center?
So it's a little challenging. We've had a few conversations with some hospitals, but because, you know, these are members of the public just coming in, and everyone is really careful about who enters hospitals. You want to keep it a safe environment. You don't necessarily just want people coming in and out of hospitals. It didn't really work out. There's a few locations we've been talking about where we could station our mobile vote centers. And that's something that if you are interested in that, I know we partnered in the past. I'm not sure if it was with your hospital directly. I know there was some partnership in the past where we had our mobile unit, which is basically like a vote center on wheels. We drive up and we unload the equipment and people can vote. I can look into that and follow up with you if you are still interested in having that. That might still be an option.
Thank you, Jeff. I think we were also very interested in maybe getting one of the ballot drop-off boxes because not just the patient population, but the employee population of the hospital is in the thousands. So it's a really big number. There's another question here about how can houseless neighbors register to vote? What special programs or initiatives do you have to help the unhoused?
Yeah, so you do not have to have a residence in order to vote. It's everyone's right as long as you're at least 18 and you're a U.S. citizen. And of course, there's some of these other sort of more specific requirements, but in general, 18 and U.S. citizen. To register someone to vote who does not have a residence, you would list their cross streets where they live, where they make their encampment or they generally stay at night. So, northeast corner of First and Elm. And that's how we know what precinct to place that person into. The one additional piece of information we do need for voters experiencing homelessness is a mailing address, because we need a place to be able to send their materials. A lot of individuals use DPSS offices. They might have their own PO box. They might use a friend or a family member to receive their mail at. So that is the one thing to keep in mind. We recently did a huge training for a number of the homeless services agencies to help train them, and they want to incorporate voter registration into their intake process. And so that is something that we continue to do. And if anyone is interested in having a training like that, if you work with communities experiencing homelessness, we're happy to arrange that, because there are some good details that we can provide in that training. It's about a half-an-hour training. Feel free to contact me offline and we can set that up.
Great, thank you, Jeff. Very interesting. Final question. I guess there were some challenges. One of our attendees has recognized there were some challenges at the Hazard Park Center in the March vote, and so about making sure that that the centers are well staffed, that there's smooth operations, and that people in line will not be turned away.
Yeah, so just a little bit. There were some challenges, not just at that specific location, but a number of locations in the primary. I don't think that's a secret to anybody. It was well documented in the newspapers and board hearings and so forth. We moved to the vote center model. It was a pretty dramatic change from the way we've run elections. It changed pretty much every aspect of our department. And so anytime you roll out a new program, and this is not to be defensive or anything like that, just the reality of when you move to a massively new project that changes everything, there's a lot of unexpected variables, and a lot of things can come up and become challenges. So there were challenges for us, for sure. The two biggest areas were the check-in process, which became sort of a choke point for the getting people in efficiently into the vote center, which ended up creating lines. And then there was some logistics in terms of setting up, dropping off the equipment, setting up, and breaking down. And both those things were dramatically different than anything we'd ever done in the past. Those two have been a huge focus of our improvement for the November election, in addition to a number of other items. So we feel confident moving into November that we've really addressed those, and that they will not be an issue. So I apologize to anyone who may have had issues, including this location. And we really do not, that's not something that we ever want. And we do not want people to have a bad voting experience. We don't want people to feel that they have to leave and they couldn't vote because it was just too chaotic or it was too long of a wait or anything like that. So there's some really great improvements I think people will hopefully see in the November election, although many people may end up just voting by mail anyway. Great.
Well, thank you for that, Jeff. I really appreciate the presentation. And Are there any questions that people would like to ask in person? All right, with that, I think we're going to move on to our next speaker. But Jeff, if before you leave, if there's a link for the maps to the voting centers, you mentioned that that site may be updated a bit. If you could put the URL link in the chat,
Sure.
we'll make it in our notes that we send out after the meeting.
Okay, and I'll put my email in the chat as well. That way people can contact me.
Terrific. Well, thank you so much. I mean, it is an enormous shift from the old model. It's very exciting to see some of these new initiatives to make voting more accessible for all. And certainly we wish you and your organization all the best in terms of a smooth operations this fall. And
Yes.
it was a big learning curve this year, but it's exciting to see, you know, sometimes through this difficult process, we get really big improvements. And it's exciting to see the opportunities for more people to vote, for more accessibility. And I'm excited to think about having the opportunity to cast my ballot at the Pantages Theater, because I'm a little.
Yeah, it'd be great.
So
Yeah. I don't want to promise anything, but I've heard one thing they're working on potentially is Hamilton themed I voted stickers.
oh boy.
So I don't want to promise. If it doesn't happen, don't come back yelling at me. But I've heard through the grapevine that may happen. So we'll see.
Very exciting. Very exciting. Well, thank you again, Jeff.
Okay. Thank you.
With that, we're going to move on in our agenda, and our next presenter, our next speaker, is our own Jorge Orozco, CEO of the LAC-USC Medical Center. So I'll invite Jorge to share with us some updates from the campus in the time of COVID.
Good morning, everyone. Can you all hear me?
Yep.
Yes.
Okay.
Yes.
So things are kind of quiet right now. We still have daily admissions of individuals with COVID. The vast majority are not coming in with COVID-related symptoms. They're coming in because of other issues. They fractured their leg, they have problems with their diabetes. Oh, and by the way, they have COVID as well. In our 4 hospitals across the county, there are a total of 70 patients in the hospital. 35 of them are at LAC-USC Medical Center. So we continue to see the vast majority of cases here. And of those 35, there's about 7 that are in our ICU. We are ramping up our efforts to vaccinate everyone, all of our employees, all of our patients. We are concerned about the twindemic with the flu and COVID in the fall. And we're just gearing up for another spike is how best to put it. We have started focusing in on reopening our procedures and specialty care visits and our operating rooms. When COVID started back in March, we canceled a lot of elective procedures, and we canceled a lot of visits and shifted a lot of visits to phone and video visits. And of course, you know, those non-urgent issues become urgent over time. So we have a significant effort to bring people back and you know, give them the care that they need. We've also opened up a drive-through vaccination and COVID testing site on our campus. So if any of you have been on our campus recently, you'll notice that State Street is closed to public traffic. But if you have an appointment, you can come in and drive through State Street, and right in front of the old General Hospital, you could receive a test. And most of the tests that we're doing are pre-surgery, pre-procedure tests. And so this is not a testing site that is open to the public. It's a testing site for our patients before they have their surgeries or procedures. And then vaccinations, so drive-through vaccinations for kids, for adults, and we're doing those every day here, Monday through Friday. So that's the update on the hospital. Happy to answer any questions that people might have.
Yeah, do we have any questions for Jorge about things happening on and around our campus? We have a comment from Juana. Dalila, would you be so kind?
Ana is
Okay.
saying that
Simplemente, Jorge, quiero darle las gracias porque primero me hice la prueba del COVID ahí enseguida de la entrada a las clínicas Torres y la segunda prueba en septiembre ya me la hice allá afuera del hospital y quiero decirle que es excelente servicio, excelente trabajo el que están haciendo y de verdad muchas gracias.
De nada, Juana.
So,
Ana was just
I
expressing
do
how,
have a question.
sorry,
I do have a question. Yeah,
I'll put it,
I'm sorry. Okay, I was just wondering, last time you reported, you mentioned the age group in general. What, in terms of the cases, what is it looking like right now in terms of the patients? I know that about the number you gave us, so it's hard to generalize, but overall,
Yeah, you know, I think typically our hospital sees a younger age group than most hospitals because we're a trauma center. But the age ranges vary. You know, we've had people in their 20s with COVID, 30s, 40s, 50s. I mean, the majority who have complications enough to come into the hospital are typically older, and I'm generalizing, maybe older than 50 with pre-existing conditions, you know, make their challenges greater in dealing with COVID. But typically we have a younger age group here in our hospital.
Thank you, and sorry, Dalila. Delilah.
Heather, may I?
Of course.
Jorge, what I've heard in the news that Latinos are highly impacted. Of course, Latino, you know, Los Angeles has a huge Latino population, and also LACUSC is situated, you know, right smack in the middle of a huge Latino community. So my question is there any extra outreach, any extra education work, any extra efforts to help mitigate that situation for the Latino community?
Yeah, I mean, I think it's unfortunate what we're seeing play out. That it is a reflection of kind of the disparities in society in terms of people's access to care. We look at cases in the Latino community. If you're Latino, you're more than twice as likely to get COVID, and if you get COVID, you're more than twice as likely to die from COVID than if you're white. And it's, you know, I think it reflects the community that we're surrounded in that, you know, it's a working class community. Many are essential workers who did not have the luxury to be home and be able to telework, and had to continue to go in, you know, when the pandemic was raging, and were exposed at a much higher level to COVID. You know, it also exposed, you know, the institutional racism that exists in many institutions, including our healthcare system, and we're seeing that play out in COVID. Now, in terms of, you know, how do you address those factors in a sort of short-term kind of way? You know, obviously, the Department of Public Health is doing a lot of outreach in these communities to, you know, make sure that they're able to follow with social distancing, masking, washing their hands, which are really the three things that can prevent this from happening in our communities, and really emphasizing that to our patients. LAC USC has done an amazing job of keeping people out of the hospital, even though we've had more cases here than any hospital in Southern California. We've also discharged over 1,300 individuals back home and into their communities safely after having COVID. And we've prevented the admission of over thousands of people because they come into our emergency room, they have trouble breathing, they have COVID, and rather than bringing them into the hospital, we send them home. We send them home with home oxygen. We send them home with a nurse that can contact them on a daily basis, and making sure that they're safe, and we're able to remotely monitor their oxygen levels, and which is a very innovative program, rather than bringing people into the hospital. That allowed us to keep our beds available for those patients who were sicker.
So not so quick follow-up question, which is, I think there's an LA Times article that has some very negative coverage, without having to go through the entire article and situation. My question is more about where are we now in terms of better service to our community, and what needs to be done from a structural standpoint or a system standpoint?
Very unfortunate article that really does not reflect the care that is being delivered today. The cases that were highlighted were all before 2016, and there's been significant improvement in access and scheduling of services. So basically, this article, which I don't think has been printed yet. It's on the online version, but will be printed probably this weekend. Basically says patients wait to get services at LAC USC and at the county, and die waiting, essentially. It is unfortunate because it is a very sensationalized piece. This reporter requested thousands of documents over the last year, and clearly had a conclusion in mind, and sort of sought to support his conclusion with a very small subset. Our system sees over 1 million outpatient visits a year, and the subsets that he was looking at and the cases that he was looking at, were old. And there's been significant improvements in access to care. And the majority of our patients receive their appointments within 5 days of requesting an appointment. So doesn't say that we have room to improve, that we don't have room to improve, we do. And so there are significant efforts in continuing to invest in certain specialties to make sure that our communities have access to those services.
We have a question in the chat box. What are the statistics on COVID-19 cases of children and the houseless population, if you have that?
Yeah, I don't have those statistics at hand. Our patient population typically is about, roughly about 10-15% of individuals who are houseless or homeless, and I think our COVID numbers reflected that as well. In terms of pediatric cases, we've seen very few pediatric cases come through. With certain schools starting to reopen, there certainly is a concern about COVID exposure to kids and whether their sort of risk levels are high enough to be hospitalized. We haven't really seen spikes in hospitalizations. It doesn't mean we haven't seen spikes in infections. Clearly, anytime you're exposed to larger groups, your risk of infection goes up. So, and that's what's going to happen as schools open up as well.
So two additional.
Another question. I'm sorry.
The first was, during this period now that COVID cases are down, are you relooking at hospital staffing, and is there a talent gap where you're thinking about adding new positions?
Talent gap. Yeah, the bottlenecks that we experienced during the first surge were largely in our ICUs. And so the need to recruit more intensivists, and these are doctors with that kind of experience to be able to handle highly complex pulmonary issues is something that we are actively recruiting. And also we had issues with our respiratory therapy staff. We just did not have enough of them. And of course, you know, this is a challenging time for our employees as well. And so we've had, you know, a high number of call-offs and sick calls and exposures. And so we had to manage that on top of the surge. So those really are two areas that we're looking at. We're looking at increasing our rates that we pay agencies to bring people in so that we could be competitive with other hospitals. So those are the primary areas we're looking at.
Great, thank you. And I think the final question is, we did have do you anticipate a response to the op-ed piece by the LA Times? Is that something that you're working on?
Yeah, Dr. Christina Galley has issued a media release in response to the article that sort of lays out kind of some inaccuracies of the article. Yeah, I lost sleep yesterday thinking about, yeah, I should write an op-ed piece, but well, maybe. We'll see.
Okay, well, it hopefully will be at least like the second or third to know if you do that. You'll send us the link so we can have everyone use it. Great. Thank you so much. I think with that, we are concluded on this particular segment. Thank you again, Jorge.
Thank you.
We so appreciate getting this first-person update on what's going on at one of the major health centers across this country. So thank you again for your time. All right, with that, we're going to pivot to some of our other campus projects that are happening right now. I'm going to invite colleague, let's see, is this the right one? Start from this slide. Yes. I'm going to invite our friend and colleague, Monica Alcaraz, to give us a quick update on the Women and Children's Hospital ceremony planning.
Hello, can you hear me?
Yeah, go ahead, Monica.
Yesterday we actually videotaped and had a ceremony. Again, remember we had to be very careful about this and had only a few people there that were essential. So we had the cleansing from Aztec dancers. We had the blessing from a Tongva leader, elder. Jorge spoke. Supervisor Solis will be providing pre-recorded message. Rosa spoke and I spoke as well. I was very honored to be there, and I'm sorry that so many people couldn't be there that wanted to be at this event or ceremony recording. But understand that with the epidemic, supervisor's office, the hospital, Jorge, Rosa, it was very important that we were safe. And so, but the recording is going to come after. We're looking for stories as far as people that were born at the hospital. There's going to be things that are going to be added to it. So I think we'll be reaching out to different people. We're still looking for survivors of the sterilization to maybe be part of this. Again, it's going to be recorded. It's all recorded, and it's going to be put out into the community before the hospital actually comes down. Yeah, so that happened yesterday. So it's really fresh. But again, we had to be very, very safe. And so we kept the numbers very low because we wanted to make sure that we followed all the guidelines and that everybody involved was safe. Rosa, do you want to say anything?
Hi, everyone. No, just want to thank you, Monica, for your incredible leadership and tenacity in making sure that this event occurred. Also want to thank the committee. I know there was a lot of conversations around what kind of event this should be and whether we could have a event even through the time of COVID, and want to thank Supervisor Solis's office for your incredible support. Want to thank county departments for your incredible support, particularly the Department of Public Works for making possible the ceremony on the grounds of the Women and Children's Hospital. I know you guys are going through a lot trying to prepare the building for its demolition. And, you know, just want to appreciate that the opportunity to come together around this building is one that I know we will never forget. We're hoping the video will be prepared before the building does come down so that we can at least be able to show you the full experience, even if virtually. And so just want to thank you again. I want to thank the Tongva tribe and the Aztec dancers, Chimicheca, for coming and participating in the extraordinary ceremony. We're also reaching out to some of the survivors and their families, so hoping to get some of their experience at the hospital, and also recognizing that there's a stitching together of history, present, and future. So I want to thank Juana Mena and Ari Arambula Gutierrez for your incredible efforts in putting together a quilt that was presented to Jorge yesterday. And we're hoping once they've completed the quilt with some messages from the experience of the Women and Children's Hospital Committee, that we will be able to present it in a nice frame in one of the buildings of the Restorative Care Village. So thank you, everyone.
Wonderful. Thank you so much to the committee. We're so excited to see the output of this incredible effort when we get to enjoy the video as it's put together that really celebrates and commemorates this space. With that, we're going to move forward to our presentation. Oopsie, wrong direction. Let's see. Something is going on here. There we go. The next presentation will be by Alicia Ramos from the Department of Public Works on some of the campus projects and their current status. Alicia.
Thank you, Heather. So that's a perfect segue, speaking about the recent ceremonial activities that took place yesterday. So here's Women's and Children's Hospital, which still stands.
Sorry, give me 1 second. I'm so sorry, Alicia. I'm having challenges. All right.
That looks good. Next slide, though, Heather.
Yeah, that's where I'm struggling. I can't seem to adapt.
Okay.
My pardon. I'll be right back with you. I think I just need to relaunch the PowerPoint presentation. All right, I think it's up.
Okay, thank you, Heather. So yes, so Women's and Children's Hospital still stands, and we have experienced some recent, I think, step back on the demolition. We are in between phases of work. We've completed what we called the debris removal, which was the removal of all the contents inside. And we were targeting going to the board for approval of the next phase, which is the structural demolition of the hospital. And that was scheduled to have taken place this month. But like I said, we've had a setback. The proposer on the project has hit some issues and conditions that we are trying to work out. So contractually, there is a little bit of extra work that's going on behind the scenes right now. And we are hoping to retarget that award of contract with the board soon. So to that end, I think relative to the video that will be coming out with the commemoration ceremony, we think that the building will still be standing a little bit longer. So to that end, I think that's beneficial. Next slide, Heather. The Restorative Care Village is currently under construction, which is on the neighboring site to the Women's and Children's Hospital. We have completed earthwork activities and we're now getting into the foundations. So we've obtained all of our building permits to do the construction, which will start to go vertical very soon here. So that's positive progress. And we are also underway with the civic arts process on that project as well. Next slide, Heather. Child Care Center is also a project on campus that is underway. Child Care Center has also two phases. The first one, what we refer to as the make ready work, which is basically the clearing of the site, taking away some of the things we have out there that just are impeding construction, which would be some concrete pads, vegetation, things of that nature that have been cleared away. And we will, oops, we lost the slide on Child Care Center. There you go. So the building plans are under review with Building and Safety for permit approval. And we expect to come out of Building and Safety soon with those permits. And then we'll see the second larger phase of this work start to happen on campus, which would be the clearing and construction. And the civic arts process is also underway with this particular project. And with that, I am going to hand it over to Iris Rain of Civic Arts to talk more on that.
Hi, everybody. I wanted to, we talked last time about the artwork that's going to be a mural on State Street on the front of the building. And a call for artists was released last week or this week. And I wanted everybody to be aware of it. There is a link to the call for artists, which is also called an RFP. It's request for proposal, but it's just a call for artists at this point, not for proposals, for people to submit their just work samples. And if you could help spread this information so that we can attract a large number of artists that would apply, that would be great. I'm going to post the link in the chat and also my email in case anybody has any questions. And I also wanted to mention that I am holding a Zoom workshop about the process for any artists that are interested, where people could ask questions about how to submit and that sort of thing. And that's going to take place on this Monday at 6:30 on Zoom. So I will post that information in the chat. Thank you so much.
Thank you, Iris. We really appreciate the update on all of the campus projects and the opportunities for community involvement and inclusion. Are there any questions for our presenters on the campus projects? Not at this time. All right, with that, we have an update from the Local and Targeted Worker Hire project. I'm going to ask Alicia Ramos to come back and share with us some of the information about some of the local and targeted worker hire goals for the project.
Great, thank you, Heather. So we've summarized with the projects that I just previously mentioned and their status, we've summarized what our to-date efforts have shown in terms of local targeted worker hire efforts. On the Women's and Children's Demolition Project, as I mentioned, there were 2 phases to this project. The one that we've completed is the debris removal, and we were very successful in that phase of not just meeting the required thresholds, but meeting the aspirational thresholds. Required being 30% for local worker, but for these projects, we have included a aspirational goal, which is 50%. And what I'm showing here is for the debris removal, which is complete, we ended with a 73% local worker hire percentage, which is fantastic. As far as targeted worker goes on that phase of work, the targeted worker percentage requirement is 10%, and we met that with flying colors, 64%. We are yet to start the second phase of women's and children's demolition. So when we do start that, we will also keep you updated on how we're doing with local targeted worker percentages on that project. With Child Care Center, which is the next project on the slide here, we have the 2 phases. One is the make ready. And the make ready work, we hit 48%. So we fell just short of our aspirational goal, but very close. For the targeted worker, this is a percentage that we are listing as not applicable. And I want to give a little bit of background to that. The 2 phases for Child Care Center are being handled by 2 contract types. The first phase for Make Ready is being handled by what's called a job order contract. It's a slightly different method of contracting. For that contract in particular, it's based off dollar amount for the work that they perform. So certain dollar amounts have certain thresholds. For this particular portion of Child Care Center, the dollar amount for the work that was performed through JOC was at a threshold that the targeted worker is not required by their contract. And so that's why it has the non-applicable. But for the second phase that's coming with childcare, both of these will certainly be heading towards the aspirational goals. So more to come on the Child Care Center. The last project is the Restorative Care Village project, which is currently underway. And what we're showing for local worker hire is nowhere close to where we want to be. We're just under 5%. And with targeted worker, we have not hit any recorded numbers. So with this, I do want to give some background. With the work that's going on or that has come to a recent completion is the earthwork, the excavation, which requires a lot of specialty trades. I shouldn't say a lot, it's really specific specialty trade in heavy equipment operation. So we've been looking at these numbers, trying to figure out what the factors could be and why they're so low. The first consideration is that for the initial work on Restorative Care Village, there just isn't a lot of trades. It's very specific. It's excavation, it's heavy equipment operation for earthwork moving. And so with that, we have limited opportunity for how many trades we can reach out to because there's only so many activities going on site and they're very specific. So that's one of the factors that we're recognizing as to why the numbers could be so low. But above and beyond that, we're working with the contractor, with their jobs coordinator, because we're concerned about the numbers. We want to make sure that as we go into the future phases of Restorative Care Village, where we will have much more construction activity and more trades coming on board, drywall, framing, steelwork, painting. When those trades come on board, when those activities start to happen, our impression is that we will have access to many more local workers simply because we have more trades going on and those trades have more availability for labor in those markets. So we are working to address those numbers and we hope to come back to you with much more improvement.
Thank you, Alicia. Does anyone have comments or questions for Alicia on this update on the local projects and our local and targeted worker goals?
This is Ari. I understand that you know, now with the SoFi Stadium done, there's might be more available. I know they had goals for local workers in that area, which is, you know, it's not exactly, but you might be able to get target workers from that. I was just wondering if you do a little cross-pollination there.
That's an excellent point, Ari, because previous to the COVID situation happening, one of our biggest challenges in construction and also with pricing of construction was the labor shortage in general that's happening in the Southern California region. So I think that's an excellent point. I think as some of those larger projects complete, we hopefully will find that we've got a pool of skilled workers that are available, because we may have skilled workers in the local area, but if they're already committed to other employers and other projects, then obviously they're not available to us. But as those projects start to complete, then again, that would be a factor that we would start to look at that would benefit the projects that we have coming forward. So excellent point.
Anything else for Alicia?
Heather, I have a question.
Please go for it, Yolanda.
Yeah. So I heard the cross-pollination comment and efforts, but I think at this point, relying on additional trade workers to be there in order to increase your net, let's say to widen your net, is probably not enough. I think what you need to do is a real explicit statement to the unions and to these large groups that you have a target, that this is the population we're looking to acquire, to augment our numbers and to make sure that the communities are cared for in a way. So unless they hear from us that this is an explicit attempt to increase and target the local workers, I think it's not going to happen.
Hi, good morning. This is Isidro Villanueva. And so it sounds like there's a lot of questions around kind of the game plan here. So I don't know, maybe Heather, if maybe we should segue into kind of my presentation, because I do want to piggyback on kind of what Alicia shared and maybe hopefully try to answer some of those questions and maybe speak to, you know, some of those efforts that are being presented here. So I guess if it's okay.
Sounds like a perfect segue to me, Isidro. Yes,
Great.
We are inviting Isidro Villanueva from WEDAX to continue the conversation on local and targeted worker hire, and then perhaps at the end of that presentation, there'll be a richer set of questions, and some of them may be answered along the way.
Great, thank you, Heather. Again, Isidro Villanueva here with the LA County Workforce Development Department. I hope everybody's well. Hope everybody's staying healthy, staying safe, and staying motivated during these challenging times. But yeah, I just want to go ahead and piggyback on Alicia's presentation, and then just kind of comment a little bit further as to, you know, what we plan to do moving forward. Like Alicia mentioned, on the LEC USC Child Care Center, the goal there that was met was 48%. Obviously, we know that the county policy is 30%, so the contractor was, you know, above that. As far as HICP group here, there was an aspirational goal of 50%. So I just kind of wanted to give a breakdown of what that meant as far as the local worker hours. So in LA County, the way we measure the local workers are basically two tiers. Tier 1 is a 5-mile radius, and then tier 2 is a set of qualifying zip codes throughout the county. Okay, so in this first project here, the 48% was met with 56 hours of tier 1 workers, and then 872 hours of tier 2 workers. And so we can go to the next slide, Heather. So again, so here's the listing of the different zip codes as far as tier 1 and tier 2 based on the projects at LEC USC. And this kind of just gives you that, and basically there was one worker from tier 1 from the 90040 zip code, And then there was 1, 2, 3, 4, 5, like six workers that made up the tier 2 workers. Again, so I just wanted to share a little further breakdown as to how that 48% was met and what it meant between tier 1 and tier 2 local hours. Next slide, Heather, please. And so here again, a little further breakdown as to how those hours broke down by trade. So here we see that, like I said, there was an electrician that was on board, actually 2, but they were from tier 2 local hours. So there were 16 hours, 8 of those, again, local for a tier 2 worker. And then another subcontractor had an operating engineer and some laborers on the job, and those how the tier 1 and tier 2 local hours were broken down. Next slide, please. So in the past, there's been questions as to why we look at hours versus like actual individuals. So in California, the policy is that we look at hours versus workers on a job. And I think hours just shows a greater impact on the local communities as far as local workers versus number of actual workers. And so an example here, if there's a 1,000-hour project with a 30% of workers qualifying as local, let's say you have 100 workers on that job. Well, really the contractor can go out and hire 30 local workers to meet that 30%, but then he can only have them on the job for an hour. So there's 30 workers meeting the 30%, but then total they only work 30 hours on the total project, versus if you have a 1,000-hour project and you need 30% of those hours to be local, then you have 300 hours that are going to local workers. So that's why we measure local hours versus local workers. So again, I just kind of wanted to give an example as to why, and again, it's state policy that on these projects we measure hours versus workers, and this is an example why. Next slide, please. So
question, if I about, you showed us the zip codes that you're counting from and all that stuff, but is there a recruitment, an active recruitment? For example, I don't think I've seen any ads around this.
Yeah, so that's kind of what I'll get into. And so if you mind, I can go through the presentation and speak to the active recruitment and what we plan on doing forward, because the next project I wanted to speak about was that one project where we're at just under 5%. So yeah, Heather, if you want to move forward. Yes, thank you. So here, the current project is at 4.95%. So there's been a total of 2,465 hours that have been worked on this project. 122 have been local. Tier 1, only 48 of those 122 have come from Tier 1, and then Tier 2, 74 hours, again, from those additional zip codes. Next slide, please. Again, so the same zip codes, we're looking at Tier 1 so far, 90015 and 9029, and then the 90630 for Tier 2. Next slide, please. Again, and this is just a breakdown of how those hours are broken up. But to Alicia's point, where she mentioned that right now there hasn't been a lot of opportunity, just given the particular trades that are involved. You see here that there's been a field surveyor and operating engineers on the job. And so that's where the majority of the work has gone, like Alicia mentioned. So there hasn't been a lot of opportunity, and a lot of these hours, I think it's just been like one field surveyor on the job. I think there's 2 operating engineers. There's been 1 plumber that's done work, and he wasn't local. And then, the other hours, it's been like 1 electrician, and then like like 1 or 2 of the other trades. So there hasn't been a lot of opportunity to move individuals or local individuals into this project, just based on, like I said, Alicia mentioned, just based on the work that's going on right now. Now, moving forward, though, what we want to do, next slide, please. What we want to do is work closely, and we already have started working with in this particular job, the contractor does have a job coordinator. who is Casimar. And so we've been meeting with Casimar and kind of coming up with a game plan where we can recruit and refer local workers to Ari's previous question, and I think Yolanda's question as well. We can source individuals from other projects. Now, just keep in mind though that, SoFi geographically, it's just another part of the county. So local workers might not come into play, but we can certainly recruit maybe targeted workers to come on the job. But then just keep in mind that they may not be from the local area exactly. But definitely if there's a need to recruit targeted workers from other projects, we will look at that. But what we want to do is really focus, and I think what the group here wanted us to do is to look further, or I guess within that 5-mile radius and target a specific 2-mile radius of the project. So that's what we want to do. And so what we have done, and then I guess maybe we can go on to the next slide. I think it's the next slide. Well, maybe we can come back to this. The next slide, please. Sorry, next slide. Sorry, next slide. So what we have done is met with so there's obviously a local hire workforce subgroup that meets. And so then I guess we've created an additional subgroup to specifically talk about recruitment and training. So our East LA America's Job Center, our Boyle Heights Workforce Center, the East LA Occupational Skills Center, and then the USC Office of Civic Engagement, we've met to kind of put a plan in place so that we recruit and train and kind of again target the specific 2-mile radius. So what we're gonna do is we're gonna create a flyer so that we can start recruiting local individuals. They'll be sourced, if you will, through our East LA AJCC and our Boyle Heights Workforce Center. So anybody that's interested can be referred to one of those 2 agencies. And then those particular agencies will work with those individuals to determine if they have the required experience so that we can refer their resumes over to the jobs coordinator, or if they're interested in training, then we can refer them over to the East LA Occupational and Skills Center. So we'll be creating a flyer. Hopefully we'll have that flyer ready to go by next week. We can share it out so we can start doing the recruitment, start making referrals. My understanding is that, again, the work will start to ramp up and there will be the opportunity to have more trades into this particular project. So again, we're working with the jobs coordinator. We're asking Casimar, who again is a jobs coordinator, provide us kind of with a list of their trades and when they expect them, so that we can kind of figure out as we're recruiting which type of individuals we can recruit, and then refer over to Casimar. And then hopefully again, that'll help increase not only the local worker goal, and then also the targeted worker, but then again, the goal is here to again, not only get them to that 30%, which is required by county policy, but also get them to that 50% aspirational goal. And in addition to that, look at a 2-mile radius. But again, we would also be relying on, I guess, everybody here to help us with that outreach and make sure we're specifically targeting, the areas within, that 2-mile radius, so that again, we can source more tier 1 workers and tier 2. At the very least, like I shared in the previous slides, we're hitting the numbers, or the contractors hitting the numbers, but with tier 2 workers, we definitely want to increase the tier 1 workers, and then definitely have further involvement from more specific areas within the project. I had some slides that I skipped over, but I can just talk to them here. Within this work group, we're also going to oversee the 3rd and Dangler project that will be coming online. As far as I know right now, it's scheduled to go online on May of next year. So then there's also going to be opportunity there to have, since it's in close proximity to the LEC USC, and most likely it's going to encompass pretty much the same zip codes, that any individuals that we recruit during this period or put through training, then we can also look at putting them on the 3rd and Dangler projects as well. And that's a housing development project, again on 3rd and Dangler. And right now it's scheduled to get started or to close as far as being awarded in May of 2021, with construction starting shortly thereafter. Again, there might be a ramp up period, but hopefully, again, any referrals that we get on this project or any other LEC UC projects leading up to that project, as they come off of those projects, then maybe we can again refer them over to the 3rd and Dangler project. So again, we'll have a flyer for recruitment. We'll share out, again, referrals should be sent again to our Boyle Heights Workshop Center or ECLA AGCC. And then they'll help the individual determine again whether they feel that they're job ready or if they need training. If they're job ready, then the resumes will come to us and we'll share with Casimir, and then work with them to coordinate interviews and recruitment efforts. And then if they need training, we'll refer them over to the East LA Occupational and Skill Center and put them through training and get them ready for either current projects or upcoming projects that are coming online. I know there was a question specifically about the targeted workers. So there is I think there's 14 different categories that make up the targeted workers. I don't know that they're tracked specifically by group. So they're just kind of, if they're like a targeted worker, they're just marked as a targeted worker. So in other words, if they meet one of those categories, they're just marked as a targeted worker. They're not tracked as if they're, like a veteran or re-entry or homeless, an individual experiencing homelessness. So I don't know that if that could be done or what the policy might be around that. They're just tracked as a targeted worker, and I don't know that we track specific populations, since I guess in a way they're all weighted the same. But I don't know if maybe Alicia, if you have any thoughts on that, if that could be tracked or not. I know at this point it's not being tracked just because if they're a targeted worker, then they're just marked as a targeted worker. And
I think that's certainly a question that we can bring up with the jobs developer, because I think, as you said, it's first and foremost whether or not we're able to do it. And when I say able, it's really from a legal standpoint first. And if we are, then perhaps it's something that we just haven't put a filter on. So certainly we can ask that question. We can work with the jobs developer to see if that's a possibility.
Great, thank you. So we can move ahead, Heather, maybe a few slides, I think now. Yes, here. And so then I know there was a question about just sharing some labor market information. So this data here, and actually thank you to Alicia and Robert Murphy from Public Works for providing that additional data that I was speaking on. So thank you for that. And then this labor market information we gather from the Opportunity Insights Project, which is a collaboration between researchers at Harvard, Brown, and the Gates Foundation. And there's a link there, so if anybody wants to go in and look at the additional data, you can. But in LA County, small businesses as of September 13, 2020, and this goes back to compared to January of this year, small businesses are down 27%. In other words, just over a quarter of our small businesses closed during COVID and still remain closed. The biggest industries that were hit were retail and transportation and leisure and hospitality. In particular, leisure and hospitality is down almost 39% as far as the number of businesses that have shut down. Job postings, and this is as of September 18th, and again, it's comparing to January. Overall, job postings are down a little over 9%, with again, leisure and hospitality being the hardest hit, over 53%. Then professional business services, manufacturing, and education are again some of the biggest hit industries during COVID. Next slide. And then income level. So this is comparing individuals that were making $60,000 a year compared to individuals that were at the lower end making less than $27,000. Overall, the employment rate is down to 13.1. If you were making over 60,000 or individuals making over 60,000, the unemployment rate is at 8.2, where now individuals that were making less than 27,000, again, hardest hit, just over 25% of those individuals lost their jobs. So, and then since then, higher wage earners have recovered far more than low wage earners. So they're the ones coming back and finding jobs. Doesn't necessarily mean that they're finding jobs back within, you know, their former employer, their former industry, but they're just the ones that are, you know, getting hired back on first. And so about, you know, individuals that were, you know, on the lower income side of the equation were about 3 times more likely to have become unemployed during COVID, and probably still, again, are probably the population that's having the hardest time getting back to full employment. On education level, again, it's overall is down 9.2%. And then if there was some moderate level of education, it's down 2.4, where again, minimal. And I'm not sure how they define minimal, but I would assume it's either high school diploma or less. Again, the hardest hit at you know, 43%, just over 43% of those individuals with minimum education are the ones that, you know, lost their employment and are still, you know, finding a hard time of finding employment. I didn't pull any information on demographics, but again, I would probably assume that the hardest hit communities would be our Latino communities and our African-American communities, as far as the individuals that find themselves who had either lost their jobs or finding a hard time in finding employment. On our end, we have applied for what we call dislocated worker grants. So this is special funding from the state that comes from the federal government in order to create programs to kind of get these individuals some temporary work so that we can kind of transition them back to work. And so I think I've shared some information before on different projects where we are sourcing and trying to get workers who have been dislocated during the pandemic. And these are projects such as, I don't know if you heard, like a Project Room Key, Great Plates, contract tracing, and just again to kind of give people some relief and provide them with some income during these hard times, and hopefully work with them and trying to get them back to full employment. And then in addition to that, we are working, we got some CARES Act funding money. And so we are working with the Los Angeles Economic Development Corporation to do a couple of things. One, they're creating, or they're gonna be providing industry insight specifically to LA County, so that we can look at the industries that are expected to come back, how long it would take, and then to look at also the individual workers and communities that will be impacted as the economy starts to recover. So again, we're working with the Los Angeles Economic Development Corporation so they can provide us a workforce analysis report. So that, again, that we can kind of start seeing what we expect to see, I should say, in the economic recovery, so that we can kind of prepare individuals for those particular jobs, and also target specific populations. And then in addition to that, there's going to be a Safer at Work campaign that'll be launching hopefully in the next couple of weeks through the Board of Supervisors. And again, it'll be kind of a campaign to kind of reinforce you know, the safety protocols, the importance of PPE, washing hands, social distancing, and just establishing, you know, protocols, safety protocols at businesses and with individuals as they work together, so that we ensure that, you know, our economy not only recovers, but that it stays open, and that businesses, you know, thrive and kind of fully recover, and we don't see a spike in numbers or a shutdown as the economy starts to reopen. So I think that was the last of my slides, I believe. So I don't know if there's any additional questions or comments. If not, then like I said, we'll get that flyer ready and out to share with the group. And then, like I said, that subcommittee, workforce recruiting and training worker, will be working on making sure we're targeting the right areas and getting the right individuals.
Perfect. Thank you so much for the presentation, Alicia and Isidro. Wonderful to get this update. And thank you very much, Alicia, for offering to follow up on the additional information related to the categories of targeted workers. With that, to make sure that we finish up on time, I'd like to move forward in our agenda and invite our next presenters. We are marking LGBTQ Visibility Month with a presentation from the Latino Equality Alliance and Mi Centro. Right before we get started with this, though, I do want to remind everyone, as mentioned at the top of the presentation, we will be sharing the recording of this segment with our USC film students who have joined us today. This is part of a potential student film documentary that's being created that will feature our own Ari Gutierrez Arambula. So we're very excited for Ari to be part of this fun initiative. We welcome our two USC film students who've joined us today. But please, if you are not interested in your image being recorded or your name being recorded as part of this segment, now is your opportunity to put your video on mute, and or you are welcome to rename yourself to anonymous or another name if you prefer not to be included in any way or identified in any way. So I'll give everyone a few seconds to do that, and then we'll move forward into the next presentation. All right. With that, I'm delighted to welcome Ari Gutierrez to kick off our segment on LGBTQ Awareness Month.
Okay, thank you so much, Heather, and thank you for everyone who's here today. I wanted to, when we meet monthly about what are the important topics, I wanted to make sure that we highlight LGBT, what we're calling Awareness Month, because something that came up is that, usually we have Pride Month in June, but in a school calendar, June is the end of the school year. So we wanted to be able to do something up front. And so because of other certain holidays, which you'll learn about today, we are looking at the chat. Okay. So what we're going to learn about today is what we're doing earlier in the year to bring awareness and to connect people to resources. So with that, I wanted to, I asked our outreach team to present some information about that. And then we also have a collaboration with the LA Community College District. And so we have someone, one of the trustees to touch on that, on those activities and what's going on there, especially around housing for students and things like that. So Norma and Jesus, please welcome. Please go.
Hola. Hello everyone. My name is Norma. I know Jesus is on. Where you all at, Jesus?
Hi everyone, I'm Jesus.
Today we're going to be presenting how to be an LGBTQ ally. Like I saw in the chat, yes, June is LGBTQ month. However, October is LGBTQ History Month. So bam, we got 2 months. So we have a lot that we're going to talk about. So an overview of what we're going to talk about, we're going to talk about introductions, right? So who we are as Leah, LGBTQ identities, how can we support, as in what can we do as a community to be a good ally. Then we're going to move on to LGBTQ awareness dates in October. So the dates that are specifically tied to LGBTQ awareness and support program referrals for LGBTQ youth and their families.
Norma, if I may interject.
Yes.
Part of the big reason that we want this to be covered with the HICP is because you are community organization leaders and influencers. And we would like for you to have this type of programming at your location for your constituents. This is why we're sharing it. Thanks.
Thank you, Ari. That's really informational. But yeah, let's talk about Latino Equality Alliance, right? So what do we do and what has happened? So in November 2008, the Prop 8 ballot removed marriage equality from the California Constitution. After that, Latino Equality Alliance, or Alianza Latina por la Igualdad in Spanish, was established by LGBTQ Latinx grassroots organizers, Ari of which is the founder, go Ari. And then in April 2013, Boyle Heights and the LGBTQ Forum on Youth, Families, and Community Services was given. It was one of the very first forums that was given during those times. specifically for Boyle Heights and Latinos. In 2015, Prop 8 was overturned and U.S. Supreme Court ruled in favor of marriage equality, right? So a complete 360 from 2008. Then in October 2015, which we just completed our 5 years, Mi Centro LGBTQ Center opens in Boyle Heights in collaboration with the Los Angeles LGBTQ Center. In June 2018, the LGBTQ rights resolution was adopted by LAUSD School Board. And there's still a lot more work that needs to be done, but this is just what we have accomplished so far. Next slide, please.
I just wanted to make one note. We have a note in the chat from our translator, Elisa, asking if we could please slow down just a little bit to enable her to be able to do the Spanish language translation.
Got it. I will slow down.
Thank you.
Okay, so talking about identities, right? So we know what LGBTQ is, we've seen it, but what does it mean? So L means lesbian, G meaning gay men who like men, and is also used as an umbrella term. B for people who are bisexual, who like both women and male, and can be transgender women and male as well. And then we have transgender, someone who is transitioning from one gender to another, be it feminine to male, male to feminine. And then we have queer, which is also an umbrella term for somebody who belongs to the community. And we have taken back this word to be a more positive version of what it is to be part of the community. And then if you look to your right, you will see that the flag in itself has a lot of colors that are very positive, right? So for the new flag that has been created, meaning diversity, inclusivity, life, healing, sunlight, nature, harmony, and spirit, that it's more than just your sexual identity and gender identity. It's a way of life and the way that we present ourselves, and just knowing that this all comes out of positivity of wanting to just be included and wanting to just be seen and visible. Okay, so historically, we created kind of like a timeline of what has happened. I'm not going to read all of it, so feel free to look over it. I don't know if you all will be receiving the PowerPoint, but if you do, you can go over it as well. But realizing that historically LGBTQ folks have definitely been oppressed, right? Going back and thinking to the Nazi concentration camps. In those camps, you saw folks that had pink triangles that were identified as homosexuals, and 2,000 to 6,000 of them that were LGBTQ survivors that survived these camps were forced to serve in prison after, because it was illegal to be homosexual. With that beginning, something else that was very popular and well known is the Stonewall riots, which was 6 days of protests and violent clashes with law enforcement because they were targeting the Stonewall Inn, but for being an LGBTQ inclusive club. And they didn't even have running water. So like they just wanted a place to go and be themselves. And there was definitely a lot of homophobia and transphobia during those times. And eventually the flag was created to show unity. We had folks like Marsha P. Johnson and Silvia Rivera who were fighting the front lines of this revolution. Unfortunately, Marsha was found dead, floating in the Hudson rivers due to this, a lot of hate in terms of that. Then we go through ways in which gay marriage has been kind of banned and been like denied in terms of it, right? So Proposition 8 passed, and then we move on to 2015 where we did that 360 and gay marriage was now legalized throughout the US. And through that we had really bad tragedies, right? So for example, the Pulse nightclub where 49 people were assassinated and forth. And then policies starting to change because people were seeing what is happening. Specifically, the resolution in LAUSD did pass, which I already mentioned, but it was specifically to give accessible gender neutral restrooms that are not required. However, there has been little to no implementation or accountability that has been given to LAUSD, so that is still in the works. And I don't say this to scare you all, I just say this so you all can know that the LGBT community has been historically oppressed. There's obviously way more than just this, but just so you know that there's a lot that we've been fighting for, and there's a lot more that we will be fighting for. So why does this matter, right? So 32% of LGBTQ Latin youth say they don't have an adult they can talk to about their personal problems. And that is nearly half of when you talk about non-LGBTQ youth that say the same. Specifically, Black and LGBTQ individuals were those who were most frequently targeted in hate crimes. Of these hate crimes, 521 recorded in 2018, 24% of them were made up by the LGBTQ community. 92% of these crimes were against transgender individuals, and they were violent. It can't be linked to Trump's rhetoric, so the way that he has been making the LGBT community, specifically trans individuals, out to be very negative, and the hate that he has been spreading. Specifically, also talking about LGBTQ Latinos are almost twice as likely to experiment with alcohol and drugs, and it's nearly half when you only include Latinos. So it's already high in Latino youth, and then when you add the LGBTQ component, it goes to almost twice as much. And then LGBTQ Latinos are almost twice as likely than non-LGBTQ Latinos to be excluded by their peers, verbally abused, and physically assaulted at school. So they're more likely to be bullied, they're more likely to be excluded, and they're more likely to be hated on simply because they are part of the community. So I'll pass it on to Jesus.
Hi, everyone. Thank you, Norma. So I'm going to talk to you guys about how we can support the LGBTQ community and how you guys can be allies to our community. So there's many ways, but to begin with, we begin with ourselves. You begin with you know. Start by getting informed, you know, teaching yourself and, you know, being curious and asking questions about LGBTQ culture, community, people. Another way is by respecting people's pronouns, meaning, you know, everyone identifies differently and, you know, sometimes it's not obvious, but it's always just good to just ask and ask respectfully if you're unsure. Supporting also includes eliminating this gendered language, meaning just to include creating a language that's more inclusive, that like for instance, like when you say, hey guys, reframing from, you know, like making it a super masculine and, you know, kind of creating an inclusive term like hey all or hey friends, or those are just examples, but there's so many other examples. Use your privilege to elevate others. This means that, you know, use your platform, use your power that you have to, you know, help bring those who are, you know, sometimes not at their best, you know, help elevate them and help bring them to the top. Another way is by sharing LGBTQ resources and, you know, creating safe spaces and inclusive ones that allow for people to feel comfortable to be themselves, to act as they are, and to be fully who they are. Also, supporting means actively correcting anti-LGBTQ behavior in our personal circles, because that's where it starts, you know, as we target, you know, and have these conversations that, you know, sometimes may be uncomfortable for people. It's good to have them because uncomfort builds growth, and it builds understanding and helps us understand the LGBTQ community. And finally, we have listening to LGBTQ youth because it starts when they're young. It starts when they're, you know, from a young age. It's important to let our babies know that they're supported, that they can be themselves, and that they can be who they want to be and their most authentic selves, and basically just act freely. And so moving forward in October, we have a couple of dates that allow for you to showcase your solidarity with the LGBTQ community. And so starting first, we have October 11th, which is the anniversary of the 1987 National March on Washington for Lesbian and Gay Rights. The purpose of this date is to commemorate the fact that everyone in their lives knows at least someone who is gay. And by you know, by acknowledging and creating a date that that I guess protests excuse me, sorry, let me start over. So basically, October 11th is a date where where it was in a way of counteracting violence, anti-LGBTQ violence. The founders of the date, Robert Aikberg and Jean O'Leary, both LGBTQ activists, felt that responding to anti-LGBTQ action in hateful and violent ways, with violence that would be predictable. So instead, they decided to start this date and to basically commemorate and peacefully protest anti-LGBTQ violence. And so on this day, we wear pride symbols and suggest rainbow flags and pink triangles, and just to showcase solidarity. And moving forward, we have October 15th, which is Spirit Day. And on this day, specifically, this day was commemorated as a day to go against bullying, to stand up against it, and to showcase solidarity. And on this day, people usually tend to wear purple, and this is a way of, like I said, to showcase visible solidarity amongst the LGBTQ community. And next we have, so we have National Anti-Bullying Day on October 21st, which, just like Spirit Day and Coming Out Day, it's again to showcase that solidarity and to showcase that you stand behind the LGBTQ community and that you are here for them. And on this day specifically, we wear orange, and this also is the purpose of wearing orange is to showcase solidarity and generate conversations that condemn bullying. So definitely, if you are able to actively participate in any way or shape or form to showcase your solidarity with the LGBTQ community during this month, these are just some ways. So now I'm gonna pass it back to Norma, and she's gonna tell you guys about some more facts.
Break this down, right? So we heard what Jesus said, right, specifically, and it's very important to not only wear these colors, but support it in more than just October, right? Because going back to the statistics, we're learning the facts, right? 70.1% of the students have been verbally harassed. 71% of LGBTQ students report hearing remarks from teachers, right, that are homophobic, and school staff because of the gender expression, so how they express themselves. 86% of the Latin LGBTQ youth said that recent politics have negatively impacted their well-being. 53% of LGBTQ students did not report these experiences of bullying because they doubted an intervention. So a lot of LGBTQ youth are very scared to come forward and ask for help because they fear being more bullied by staff members and or people that are not necessarily belonging to the community or educated. And it happens a lot. It's something that is very common, right? And then when they reported, right, all of these things, they don't necessarily hear feedback or a problem that is solved right away. And then going back to these facts, right, that 1 in 3 LGBTQ youth reported that they had been physically threatened or harmed in their lifetime due to their identity, right? And then specifically when we're talking about trans and non-binary individuals, these folks are the ones that are the most affected, in saying that more than half of transgender and non-binary youth have seriously considered suicide. And a lot of it is because their gender identity isn't normalized in the way androgyny is, and we're told to be really masculine or really feminine, and it's very hard when people are in between or transitioning to fall into those categories, or maybe they don't want to fall into these categories, right? And knowing that a lot of this bullying happens because of the way that we have been socialized and the way that masculinity and femininity has been normalized in our lives, right? So the proportion of LGBTQ youth reporting a suicide attempt in recent years has been higher among youth of color. So you have this layer of being LGBTQ and already receiving bullying and remarks that are not necessarily positive. And then you add on another layer of being somebody of color that is already historically oppressed. So now you have these identities that intersect, which can lead to more bullying or lead to more people not understanding where you necessarily come from. So there's definitely a lot more that comes into it in terms of like home environment, school environment, and if they have anybody to talk to. But just remembering that these numbers are not just numbers, these are people, these are their lives, and this is something that should be taken seriously. And by wearing purple, by wearing orange, by wearing these colors, and by being a genuine ally that is not only performative in June during Pride Month, we can definitely support these youth and save their life. So I'll pass it back to Jesus.
Oh, sorry about that.
Fine.
Okay. So yeah, so just to wrap it up and stuff, October is the LGBTQ month, and the reason why we established it and why it was established was because in many of our school spaces, growing up, we aren't told about LGBTQ history. We aren't, given any figures or LGBTQ figures that we can look up to. So the purpose of this month is to elevate LGBTQ culture, to elevate LGBTQ people, to it provides a role models, builds community, and makes the civil rights statement about our extraordinary and national and international contributions to the world. So it basically just commemorates our culture, and it highlights us, and it elevates us in a platform, and gives us a platform to allow others to also come in and become allies to our community. So definitely, if you are able to actively participate in any of these proceedings, I would highly recommend you guys, and it would be really appreciated. And if you have any LGBTQ family members or friends or anyone who you know, just let them know that you love them and that you are there for them and you are an ally for them. And so definitely, if you guys are interested, we at Latino Equality Alliance, so we have different programs, and we also have different ways of getting involved with us. So we have off-site workshops in community settings. We do on-campus support for high school students. At our center, we also do HIV testing, health services and referrals, DACA, asylum, and other immigration legal support. We also host an LGBTQ youth council with youth counseling. And we also, for our families, we have the Familias Afortunadas, a family counseling group that meets weekly. And we also have college success support groups for transgender, bi, and gay men. And finally, we also have support programs for transgender, bi, and lesbian women. And we, in partnership with the East Los Angeles College, we have a Chicanx class on LGBTQ history. So these are just ways of maybe, getting involved and opportunities to learn about our community and just becoming a better ally, and also taking what you learn here and spreading it, into your own personal circles. So definitely, it's very important that we support ourselves and that we get involved. Alrighty. And so, so supporting, so some ways of supporting our LGBTQ youth at community college, we can help, oftentimes LGBTQ youth experience housing issues. So helping solve, or like donating or getting involved in actively, specifically speaking from my experience, I am doing this this housing. I'm currently going to college, and I'm doing this housing program that basically sponsors my housing and while I go to school. And so definitely, if it wasn't for this program, I think that I would be having some difficulties right now, and it's definitely loaned me an opportunity to elevate myself and to to better myself. So definitely, if you're able to house an LGBTQ youth or something, be that source of.
Jesus, thank
yes.
you. I want to be able to allow Mr. Vela, who is a trustee with the Community College District, to talk about some of the programming that they're doing at their school. We've been meeting with them for over a year since he's been on the board, and talking about you know, some of the challenges. And I know some people have asked in the chat, you know, wait a minute, I thought it was easier for kids now. So I think Mr. Vela can tell us, or Trustee Vela can tell us a little more about the challenges that he's seeing on the campuses. David, are you available?
Yes, yeah. Good morning, everyone. And Jesus, thank you so much for, you know, Jesus is giving us his personal experience on housing insecurity, which is rampant right now in the LA Community College District system. Well, good morning, everyone. I'll be really quick because I know we have, Heather would like to keep us on time, and I know we're running over. So, you know, my name is David Vela. I'm a trustee for the Los Angeles Community College District. And we've been working with Latino Equality Alliance since 2018, since I was appointed to the board. I'm the first openly LGBT trustee. And through my leadership and the assistance of LEA and Ari Gutierrez, we were able to create the first ever Chancellor's Advisory Committee on LGBTQ affairs in order to support LGBT students, particularly that attend our 9 colleges. And what we're seeing again is, as Jesus mentioned, you know, we are looking at high levels of housing insecurity. Up to 30% of our students are reporting either homelessness or some type of housing insecurity. And then with food insecurity, it's going up into the high 50% and 60%. So this is all really a paradigm shift of the LA Community College system. You know, when you look at the 70s and 80s and even 90s, community colleges were looked at as predominantly commuter colleges. And what we're learning now is that community colleges, in particular in LA, are becoming the new Cal States of LA and Cal States, you know, universities, and then Cal States are becoming the new UCs in California. So, you know, as a trustee, you know, instead of, you know, a lot of the focus being on curriculum or, you know, building colleges, a lot of my work has been into assisting our students, in particular our LGBTQ students. At this point, we've been working together with the African American Coalition and Task Force at the district to represent, as well as the Dreamers in our district, to represent intersectionality in order for all students to have these resources. But just really quick, we, with our leadership of the board and me as chair of public affairs, we worked together with the County of Los Angeles and set aside, thanks to the supervisors, $700,000 that are going to a peer navigator program. These are county workers from the LA Housing Authority who are working with our students to try to connect them to housing programs that Jesus and others are part of. Recently, we signed a memorandum of understanding with Shower of Hope, as well as Jóvenes Inc. and LA Room and Board, which are, you know, again, we're looking at partnerships with nonprofits to provide housing opportunities. And this is similar to a model where, you know, last year, for example, believe it or not, 30% of all Cal State University dorm rooms were empty. And so we saw that as a, you know, an opportunity to raise money in order to get our community college students into those dorms. Again, not always that, you know, is always a good fit. So we're also looking into taking partnerships with nonprofit developers around our colleges. And then when it comes to food insecurity, the LACCD Foundation raised over $1 million last year for food cards. We issued each student $50 in the LA College Promise. And then recently, due to COVID, we were pushing over 60,000 Chromebooks. We're now in the process of purchasing laptops with better connectivity, as well as hotspots. I was working with Senator Lina Gonzalez in order to have our utility companies provide free internet for our community college students. We're going to continue to do that. That didn't pass the legislature this year. What did pass was the Berman bill, which is going to allow lottery funds to be used for our students to purchase laptops and so on and so forth. But again, just working really, really hard on all this. Thank you.
Trustee Vela, I wanted to ask you to connect the dots between, for example, on this slide, it says the housing issues and federal financial aid. How is that connected to the LGBT issue?
That's a really good point. Another piece of legislation we're working on with Congress is to create an advantage for LGBT students in particular that do not have access to their parents' income tax in order to be able to get federal aid independently from their parents, which right now, that can't happen until the age of 24, I believe, or 25. I forget what age it is, but I do know that we're trying to pass legislation that would allow for LGBT students to have a waiver so that they can get financial aid without involving their parents. And that was because, parents in particular with LGBT students will not always lend their information to their students.
There's a not family acceptance, so they're not cooperating and they're not providing their.
Well, one of the things that we're looking at, Ari, which is really unfortunate, is that where we're looking at the African American population from a lens of neglect and no outreach, which we're working on heavily right now in a task force with a lot of the BLM folks and so on and so forth. The opposite is with our LGBT students, where there is outreach, but the unfortunate part is that a lot of our students are not able to come out to their families. And so what that causes is a disconnect between the community college system and the household. And so that's what we're trying to fix a lot. As a lot of our LGBT students here will tell you, a lot of our LGBT students are already out of the home way before 18 years old. Some are out of the home as early as 15 years old. So that is what we're working on currently with Los Angeles Unified School District, is to make the connection and get these students in our system early through dual enrollment, as well as something I've pushed a lot with, which is articulation, which is basically dual enrollment. Yeah.
Yeah, so thank you, Trustee Vela, very much.
Thank you for the opportunity to all of you. Thank you.
Thanks to everyone for their attention to this important issue. I just wanted to say that, as community organizers, here we are trying to make our community stronger. We worry about, what the housing situation is, what the job situation is, and this family relationship issue is one that is there. And it's part of all of the subjects that we talk about with HICP, including health and all that. So I appreciate the time to be able to present, for our group to be able to present this. And please reach out to us and let us help you create a program at your facility with your constituents. Because in the end, we want to make community organizers, but the best community organizers are those that are educated and that are well emotionally and healthy overall. So Heather, thank you.
Thank you once again, everyone from Leah, from Mi Centro, and to Trustee Vela for these wonderful presentations. We did share the presentation with everyone. I've seen a lot of wonderful commentary about wanting to be more involved, wanting to be that ally, and I just cannot thank our colleagues at Leah and Mi Centro enough for sharing these important opportunities in the month of October to share our support, and also ways that we can help provide education to the networks that we are a part of. With that, we have indeed reached the end of our programming here today. I did want to make mention of the fact that we wanted to hear from you about future meeting topics, ideas and recommendations you have for content you'd like to see brought forward into this meeting, as well as potential speakers that you would like to hear from. So there is a link that we will share in the chat. I'll ask Dalila if you would be so kind as to share the link in the chat with everyone. And we'll also be sending it out as part of our post-meeting notes in email. It's a quick jot form survey, and you can just check the boxes of things you'd like to learn more about, and also fill in some ideas that we may not have even thought about yet. And with that, we are truly at the end of our meeting. I will ask my colleague Anna to launch our regular meeting feedback poll. And then I'll remind everyone that we are off to the races. We are back here in 1 month's time, and our next meeting will indeed be on November 6th. So the jot form survey link is in the chat. You guys are welcome to click through on that link and fill out the survey for us so we can have some of your input into our meeting design and content over the next several months. And then please also fill out our meeting feedback form to give us an impression of how this meeting went for you. Thank you again to all of our fabulous presenters. We learn so much every single one of these meetings, and I appreciate the community that we're building through this work together. Thank you so much.